Good afternoon, everyone, and welcome. I am Serene, and I'm Adjunct Assistant Professor at the Centre for Behavioural and Implementation Sciences Interventions. I'd like to welcome everybody and thank you again for taking time at lunch to spend with us here at BISI. Today, we are going to be hearing from two esteemed speakers in the healthcare space, talking to us about co-designing for older adults and with older adults. The focus of both talks today are going to be understanding how we can draw from the perspectives and experiences of older adults to co-create solutions that directly benefit them. I am now pleased to introduce both of our speakers. We first have Dr. Zhang Yichi. She is President, Chair in Information Studies, and Professor at the WikiWi School of Communications and Information at NTU. She is the Executive Director of the Aging Research Institute for Society and Education and Co-Director, Centre for Healthy and Sustainable Cities. In her area of research, Dr. Theng's philosophy is about doing scientifically based, experimental, human-computer interaction in understanding users and their interactions, especially for information systems. In her earlier research on the World Wide Web and digital libraries, and with a focus of interactive systems and devices for the elderly, healthcare education and training. We also have with us research fellow at SingHealth, Dr. Zhang Yichi. Yichi recently completed her PhD studies at the Aging Research Institute, and she is here with us to talk about her research interests on co-designing, implementing, and evaluating digital health solutions to address the health needs of the older population living in the community. She's currently working on population health research in both the clinical and community settings, with the aim to develop effective strategies that bridge the gap between research and practice and to ensure that evidence-based interventions are translated into real-world settings for maximum impact. So without further ado, I'm going to first introduce and let Professor Theng take us through her remarks today. Yin-Leng?
Thank you, Serene, and thank you for BISI for inviting me to be involved in this webinar. So this morning I'm going to talk a bit about the work that we are doing at and Arise, and specifically on some of the projects that I've been working on relating to smart and user-friendly digital health for elder care, health and well-being. Arise was started, in 2016, and the purpose is actually to build a research institute that brings together NTU faculty working in aging-related research. So we mapped the areas of research into 4 trust areas. The first trust is aging medicine. Second trust, social integration education. Third trust, aging in place. And the fourth trust is care and lifestyle enhancement. And the purpose is looking at how to empower the aging community and improve quality of life. We intend to focus on healthy, active individuals, but because we are from NTU, being a technological university, we focus on technologies. We also have big, 2 colleges, in fact, College of Humanities, Arts and Social Sciences, and Business Schools, where we look at user behaviors. So we want to also not just build technologies, but to understand, aging-related psychosocial issues, in the use of technologies as well. So I'm going to play a very quick video demonstrating the kinds of research, working with older adults.
Thank 。
.
。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 。 . 。 。 。 . 。 . 。 。 . 。 。 。 。 。 。 。 。 。 。 。 . 。 。 . 。 。 . 。 。 .
。 .
。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 . 。 。 。 . 。
。 .
.
。 .
。 . 。 I'm confident that the establishment of RISE and CPHRI will enrich our understanding of aging and offer solutions that will help us to age gracefully and confidently as a society.
I'm calling for help now. Ambulance is on the way.
Please take your medication.
So the way that we have positioned, ARISE in terms of the research focus, if you look at, the focus, there are different, stages. Promotive, preventive, curative, rehabilitative, and palliative. Within NTU, we have more than 200 faculty working on aging-related research, and they could be working in any of the focuses. What we hope to do is to focus on, promotive and preventive health. Reason is because, you have 80% of the population, in this space. And with the Healthy SG initiative changing to Healthier SG, basically older adults' health is now moved to population health. And one of the things that we are looking at is not only just about individuals, but the individual's health can also be affecting the community. So we look at personal health, community health, and very little, studies are being done in terms of workplace health. We are moving towards workplace health too. So what is ARISE doing? ARISE is a Penn University institute where we try to bring colleagues from different disciplines to, to look at cross-cutting inter-trust, multidisciplinary strategies and initiatives, ask the right questions and begin to look at what are the outcomes that we want to measure. It could be mindset change, behavioral change, sociability, lifestyle, or policy. So I just want to say a little bit about HCI. Actually, my background is in computing. I have been doing work with the World Wide Web on human-computer interaction, and that was in many years ago, 1994, when the World Wide Web is still, an application. So, the PhD work is to look at lostness in hyperspace. When we actually look at HCI, it started off with man-machine interface, but, with the introduction of laptops, it becomes, personal, interaction with the systems. So, a lot of times there's this misunderstanding that HCI is really about just the interface, but it is not. It is, yes, people interacting with technology via an interface. And this is where the technology and the people are talking, and using the the interface, like that we have built for the systems. But increasingly, we are moving from, like not only just the UI design, but also interaction design. What is the difference? The difference is that, like in UI design is like only one, like interaction that we are talking about. But interaction design is a series of steps taken to achieve a task. And UX design talks about the interaction as well as with the environmental, factors. So, like to do that, we really require, like multidisciplinary, researchers to come together. Yeah, so it is about improving the processes by which digital technologies are built, designed and distributed for the benefits of population-wide health and well-being. So I'm going to just describe one of the projects that I have embarked on, and it started off as a research project. It started in 2010. In fact, this was a project, it's like that A-Star gave a 3-year funding for me, it's like to look at the interaction, it's like experiences, it's like on innovative systems. And it's actually to, it's like to get the feedback from older adults. Remember, this was 2010, is many, many years ago. When I started, I had to beg people, it's like they didn't believe that older adults can use technologies. And, so I've been very blessed because I run, it's like 2 centers, one at the school level, and one at the university level, which is ARISE. So I could continue this project, and I brought this project to the community. So in 2016, 17, 18, so with a very small grant, we began to actually use technologies to change behaviors. So in this case, like we were using design nudges, but at the same time, we were using social nudges. I think, like recently people talk about social prescribing to change behaviors. We stopped in, like 2018 because of COVID, like, and then this, like competition to encourage active and healthy aging continued in 2023. So I'm going to play a very quick video. And this is actually, it's like translating research and bring that into community. Currently, we are measuring, it's like adherence to the program at the national level. And this program has been whitelisted by the Agency for Integrated Care.
The ISING program was initiated in 2016 by the Centre for Healthy and Sustainable Cities as an international initiative for senior citizens. Its primary focus is to encourage seniors to engage in exergaming, learn new skills, and foster social connections. The Aging Research Institute for Society and Education at NTU, in collaboration with CHAIRS, secured a generous 1 million funding to revive the ISING program following the challenges posed by COVID-19 situation. This support reaffirms the importance of initiatives promoting active aging, and it enables us to continue our mission for the next 3 years from 2023 to 2025.
因为这个活动对老人家舒筋骨很好，任何手脚都有动到，脑就是脑有动到。因为这个运动，我们又用眼力、脑力还有手力要快这样我们就不会痴呆了。
This program is very important to me because I can use my strength, get stronger, and my brain is also better.
ISING creates a sense of community among senior citizens. Through shared activities and experiences, participants develop social bonds, reducing feelings of isolation and loneliness often associated with aging. I saw this myself while working with many elderly across the country.
这个活动对我重要，我喜欢交朋友，还有可以训练我的体力，还有那个耐力，是那个思想，要不会这样迟钝。
I can see the excitement and the passion of our senior when they participate in those activities. I also felt it really helps our senior to be familiar with technology, use it for fun in their everyday life.
We have captured the essence of using technology to promote physical exercise, integrating with psychological health and also social health in a competition and spreading this in Hong Kong and Taiwan.
In addition, they help to connect communities across generations, so older adults with younger adults at the same time.
这个活动很好玩，而且这个是 NTU 主办的，是那些大学生来跟我们一起玩，所以我们也能够接触到那些年轻人，也能够接触到一些电脑的知识、电脑的游戏，不会跟社会脱节。
Together, let us build a future where our elderly not only age gracefully, but flourish in a society that values and supports their contributions.
So this is my last slide. During the COVID period, I co-wrote this paper with Laura Lacey from Milken Institute, and what we observe is that the pandemic has actually driven adoption of health technology for the elderly. I mentioned that in 2010, I have to beg people, to participate in the studies. 2016, I was still begging, to say that, would you like to take part in this competition? But today, no. We have people knocking on our doors to ask, how can they use technologies to help the elderly to age healthy and active. Currently we are looking at, creating a global network of older adults' voices to understand, what are some of the needs and the requirements, and also give feedback on prototypes developed. Yeah, so I'm going to stop here. Thank you very much.
Thanks so much, Professor Theng. So we are going to next invite Dr. Zhang to speak. For those of you who have questions, we are going to be collating your questions. Please put your questions in the Q&A. We will leave the questions to the end just so that both of our speakers have a chance to finish their remarks. And then once Dr. Zhang has also finished, and then we'll go to the questions and take as many questions as we can. We will have Dr. Zhang speak for the next 15 minutes, and then at about 12:05 or so, we will then move on to taking questions from the audience. So Dr. Zhang, thank you.
Okay, thank you, Serene, and thank you, BISI, for providing this opportunity to share some of my work done in my PhD studies. And also thank you, thank you for the opportunity for me to really reflect on what I have been doing. And thank you for providing the opportunity to meet Prof Theng again. Okay, so maybe I will start with the impact of aging. So I think everyone has been very familiar with the statistics about aging, and also some challenges that we face for aging. For example, the decline in both physical and cognitive abilities, maybe for older people, they will require more caregiving support, and elderly may have more tendency to experience social isolation. But at the same time, we also want to look at the opportunities that aging has brought to us. For example, aging provides us with a holistic approach to address different health needs. And also it inspires us to develop tailored intervention to promote physical and mental well-being. And also there are more and more community initiatives to enhance the quality of life and foster older people's independence. And also aging can bring new opportunities to transform the health service delivery. And also, more importantly, technologies are being developed to support aging. So next, I will introduce two projects that I have been working on. Yeah. So the first project was about community-based telehealth service. So this project was done during the COVID pandemic, and we realized that during the pandemic, maybe due to the fear for infection, or maybe the shutdown of the some health services. So it's more difficult for the older population to seek medical advice, to go for health institutions for their regular appointment. So we try to develop this community-based telehealth service. So we try to bring such service to the doorstep of the older population, and also try our best to lower the barrier to using technology and accessing technology. So before we develop this service, what we tried to look at is the facilitators and barriers. So so from literature and also some qualitative interviews done before this study, before this project, we tried to identify different determinants like facilitators and barriers from individual level, interpersonal level, technology level, and system level. Then based on those barriers, we try to develop our different implementation strategies and to design our prototype so that we can deploy in the community. And also, we use this implementation research logic model to outline the determinants, implementation strategies, mechanisms, and also determine the outcomes that we want to measure. Yeah. So this is what the service look like. So this is the booth. This booth was initially designed for mass swabbing tests during the COVID pandemic. So what we do is we try to redesign the booth and introduce different technologies inside the booth, so that when an older individual comes in, they can do the simple test within this small booth. So what we have done was we had Bluetooth blood pressure machine, glucose level glucometer, the smart weighing scale to measure the body composition. We also had we also received the sponsorship of an AI-assisted eye machine to help the older people identify whether there's any increased risk for cardiovascular disease. And also we noticed that the human element is very important in telehealth. So that's why we introduced this health ambassador program. So we recruited volunteers from the community and also from NTU, from different schools, so that we can pair up. So the younger volunteers can help with more on the technology side, but we also have the volunteers from HPB. They are the older volunteers that they can, because they're very good at communication, so we also get their help to talk to the older people and to introduce what we want to do. Yeah, so we implemented our service at different locations. So our phase 1 was at Punggol 21 Community Centre. Then in phase 2, we implemented in 377A Bukit Batok with the help is Rich Senior Centre. Then the third phase was at 24 Chai Chee Road. Yeah, so this project was sponsored by NTU Graduate College Community Engagement Project. So we started, we get funding and manpower support from our university. Yeah, we also designed this user journey so that when an older user comes in, it's very clear to show them what they will experience in this inside this booth, and also we have this guide to help the volunteers identify what they are going to do. Yes. And these are some outcomes. So we collected the data and did the retrospective analysis. So in phase 1, we operated a total of 236 hours and did 627 screenings for the older population. Then in phase 2 and phase 3, because there was another wave of COVID, so we saw a decrease in the total number of screenings. And also we try to, during the implementation at these different phases, we also try to adapt our implementation strategies. For example, we implemented this reminder system so that we can see it's quite effective. So it really decreased the cancellation and no-show rate. And at the same time, we also trained different health ambassadors so that in future they can also help with our service or with other service. Yeah, and we also measured the referral rate. So in phase 1, surprisingly, about 26% of the users were referred for primary care to primary care for follow-up. But in phase 2 and phase 3, because we changed the referral system, so we were unable to track the referral rate. We also received feedback, and we can see from the statistics highlighted here that the users are quite satisfied with our service. And at the same time, the feedback also tell us how to improve our service. For example, they want more health assessment to be done within this physical booth. And at the same time, they also want more educational health information, because after they receive the health report, even though our health ambassadors try to help them explain what the readings mean, they still want to know how to improve their health. Yeah. And the next is we want to upgrade our referral management system. So based on the second feedback, they want additional educational health information. So I started the next study. I tried to co-design a tele-education with the older adults. And this study was a bit slightly different from the earlier one, because in this telehealth service, what we do is we design the prototype and directly deploy in the community, but we didn't really have focus group discussion or interview because it was not a research project at the beginning. But the next study for tele-education co-design really did focus group discussion. Yeah, so this is the step. It could be slightly different with the normal co-design because of the short time. So what I did was I pre-created the prototype. This was because in my earlier interview, I noticed that many of the older people, they shared that, oh, I know telehealth, but I don't quite know. Even though I heard the term, but I don't quite know what it is because I never use it. So that's why I decided to create a prototype first and then conduct the pilot test so that the participants will have a better understanding of what teleeducation can look like and have a real experience. And then after that, based on the experience, we started the focus group discussion, and they shared their experience and also what they want, the health information needs, and also how to improve this prototype so that it can become a more scalable and sustainable teleeducation program. And then at the end, they provide feedback for the co-design workshop. Then we look at we go into the details. So when I created the prototype, and actually it was quite simple because I tried to use simpler technologies for the older people so that they can easily adopt it. So I chose Zoom as the platform, and the format was a 45-minute session, and I did the pre-post knowledge assessment using the Zoom polling function. And the session was in English because I wanted to focus the resources and efforts in designing the prototype, and also to ensure the standard and consistent terminologies used in the session. And the topic was chosen as dementia. Yeah, and the themes, the content that I covered was aligned with the WHO guideline. So in total, I recruited 35 participants. The age was from 50 to 80 plus. If I didn't remember wrongly, the oldest participant was 82. Yeah, and 24 of them were female, 11 were male, and most of them were Chinese. And not all of them, or maybe even 2/3 of them, didn't have very high education level. And 8 of them were living alone. And this, on the right side, is the summary of their pre-existing health conditions. So during the session, after we tried our prototype, I identified 5 misconceptions about dementia. For example, dementia is fatal, dementia is solely genetic, or people with dementia will completely lose their ability to perform tasks. And older people with memory loss will be having dementia for sure. And also dementia cannot be avoided in older people. Yeah. And from the pre-post knowledge assessment, we can see a significant improvement in their knowledge score measured by the dementia knowledge assessment scale. Yeah, for all sub scales, and also the mean total score. So besides these quantitative results, I also did some qualitative study in the co-design workshop. So participants shared that from this teleeducation session, they acquired deeper knowledge about dementia, and their misconceptions were corrected, and also their awareness about telehealth or teleeducation has been increased, and also they have a more profound comprehension of people with dementia. So they try to understand people around them, and if possible, they want to apply the knowledge to motivate their learning, and some of them even shared that they want to become volunteers to help other people in the community. Yeah, in terms of the feasibility, I followed Bowen's framework. So we measured different outcomes. So the duration was longer than planned because the participants were really active in participation, and also almost everyone could follow through the whole session without technical difficulties, and everyone was satisfied with the teleeducation, and everyone agreed that teleeducation is really relevant to the Singapore local context, and all of them expressed desire for the prototype to be evolved into a comprehensive teleeducation program. Yeah, they also shared some other interested topics that they want to learn in the future. In terms of the participant satisfaction, because we really want to know whether the co-design on Zoom in an online environment is really okay for the older population. And surprisingly, I feel the ratings are quite high. And the participants shared that they are really happy with the experience, and they want, so in future, if they have more opportunities, they also want to participate in co-design process. Yeah, and toward the end, I want to thank all our sponsors and partners. Without their support, our project could not be successful, and also I could not finish my PhD studies. Yeah, thank you very much. That's all for my sharing.
Thanks so much, Yichi. So we already have a few questions that have been dropped in the Q&As. I encourage the audience to keep sharing the questions that you like. It would be helpful also to let me know, or let the organizers know which speaker you would like to direct your questions to. But before I go to the Q&A questions from the audience, maybe as the moderator, I'd like to pose a question to both our speakers. Both of your projects spanned multiple years, right? And so it is quite long drawn, involved many stakeholders. And I just wanted briefly to hear from both Professor Theng and Professor Zhang and Dr. Zhang, what strategies would you say had been helpful to you to maintain sort of like the momentum and the engagement throughout the many phases of your projects, and whether or not you think that these are unique to older adults, for instance, and the varied stakeholders with whom you work? And maybe we hear from Professor Theng first, and then Dr. Zhang, you can jump in.
Thanks, Serene, for the question. I started, design with children. Actually, during my PhD years and also post-PhD, before coming back to Singapore, it was with children. And, co-designing with children means that, we also want them to be equal participants. So, in human-computer interaction, we use terms like, co-design, participatory design, and so on. And when we actually get, potential, users to be contributing to the design process, it is very helpful because you keep them motivated, involved, and aligned. And we use the same thing, with older adults. In fact, with children, it was much easier because children are very lively, they will contribute their ideas, but not with older adults. When I first started in 2010, as I mentioned, not a lot of, older adults have access to technologies and been exposed to innovations. So there was a lot of fear that they look silly, not knowing how to use technology. So we have to keep them, involved, and at the same time to be able to explain to them the whole process. Saying that they are equal partners in the design process. We take their inputs and feedback, seriously. And, and the other thing is to get the different stakeholders, not only the older adults, but also the center managers, for example, equally excited, or community partners, keep them informed, set clear and achievable milestones, continuous communication, but also tailoring, activities to their needs, and hopefully, it is not like in the past when we have, stories about failed systems. It's because we use, the kind of very rigid waterfall approach, so you finish one stage, you move on to another stage and so on. But the iterative design process helps. That means at every stage, you go back and, get feedback to change, so we are, adaptive, versatile, and so on. So that at the end of it, even if there's a long drawn process, project of, 2 to 3 years, people are, engaged, they own the product, instead of saying that, okay, you give me your needs analysis, which was actually in the past, the traditional methods. You give me needs analysis, requirements analysis, we sign the paper, 3 years later, we come back and we show you the prototype. And, there have been books written about, failures of systems, because 3 years later, the needs change. So yes, continuous, engagement, encouraging them to give feedback is very important, to show that, how this project can, continue to, evolve in the changing environment.
So what I'm hearing is that by nature, the very fact that it is a co-design process, because they feel ownership, because they feel that investment and commitment, that by design, actually, just being sure that they're involved in it does ensure sort of like an intrinsic motivation to be committed, compared to other ways of designing where you as the PI or you as the lead ends up doing the most of it, whereas like in a co-design process, everybody has a part, everybody is invested. That's really nice. Thank you so much. Dr. Zhang, so what are your thoughts on maintaining the momentum, given that your project also spanned not just several years, but several phases of COVID as well?
Yeah, I fully agree with Prof Theng's sharing, and I feel iterative design process is very important. And also during this process, the users they will really know that you are designing for them, not only with them, but you are incorporating their suggestions, their advice to our final product. So they will see the development, the improvement of our what we want to design. Yeah. And also I feel it's important to engage them to make our product interesting to them, to attract their attention at the beginning, especially for those very abstract concepts. For example, my PhD project was on telehealth. So during my first study, I interviewed them and say, how much do you know about telehealth? They just say, oh, I know, but I never use it. So I also cannot give you comments. So I think if after they see the prototype, then they will get interested. They feel, oh, this is something actually I'm really need it. Yeah, so they realize their needs. So I feel co-design is also a process for the users, or especially older people, to identify, to discover new needs for them. Yeah. Then during the maybe co-design sessions, we also try to reduce the cognitive load. For example, don't make it too long, or use more multimodal approach, not only text, and also encourage the active participation. Yeah, I feel all these strategies can be useful.
Great. I think what I'm hearing is that we know that very often with long drawn processes, for instance, people tend to drop off when they feel that they no longer benefit, they feel that they are no longer involved or needed. But what you seem to have done is that you've actually made things quite easy for them to respond to. You've involved them because you know that there are certain sort of like cognitive barriers, like things being too abstract. And so by making it more accessible, you're also making sure that they keep attracted and stay motivated. So I think that's a really nice one as well. I'd like to now go to the raging list of questions that are popping up in the Q&A. I think this is testimony to how interested everybody is. We have a question specifically directed at Professor Theng on sort of like the unique aspects of ARISE. So the question is, among the recent and existing developments in community interventions in Singapore promoting healthy aging, what would you say is unique about ARISE's approach? And how does that complement existing interventions in the community?
Yeah, yes, I've been reading this question, and like on reflection, even if you actually look at Yichi's PhD, like the telehealth project, I think like in recent years, like there has been that movement towards co-design. I started HCI, like in the 1990s, like co-design, participatory design, like was something quite new. Because like it is a new way of engagement. So like to this question, I wouldn't say like I know all the projects that have been like developed in the community, but most of the projects I've seen, they have taken efforts to engage like the like the prospective users as early as possible in the design process. And like for ARISE, it is a Penn University Institute. Like so for my projects, because I come from the discipline of human-computer interaction with user-centered design, like it's very natural that I start with needs analysis, so I identify the research problems, and then like you do the iterative design. But for some of our colleagues, like in NTU, like they could have actually started with a lightweight needs analysis. But when it comes to implementing it in the community, I think, it's like getting user feedback doesn't need to be, it's like if you start a project from scratch, yes, you can. You do, like needs analysis from the ground. But if a project has already been developed, like a prototype, it's like we can still continually getting feedback from the community. So at every stage, we can do this, it's like, yeah. So in terms of how unique it is, we are trying to bring, it's like the different disciplinary, it's like approaches. It's like So as I mentioned, my background is in human-computer interaction. It's like I am able to communicate, for example, with behavioral and social scientists a little bit easier than a hardcore computer science person. It's like, so I see myself as a mediator between a very hardcore computer science person and a social science, a behavioral science individual. The reason why I said this is when I joined NTU, it's like in 2001, so I was working on an engineering project. But they actually brought me in because of the, like the user interface design, where it was extended to include, like more users, like engagements and feedback. Yeah. So yes, it's like from NTU's perspective, it's like for the projects to be, it's like slowly implementing it to the community, it's like we would encourage a lot more user feedback, it's like, and how that can be, it's like integrated into the process itself. And it doesn't need to be so long, it's like, what Yichi and myself, we have been describing the projects are actually research projects, it's like the A-Star project was funded for 3 years and we were doing small scale studies, it's like to understand the interaction and the user experiences. And the same thing with Yichi, it's like, but knowing the process, it's like we can actually shorten it to understand what is it that we can, it's like get feedback and begin to infuse the users, it's like it's like feedback into the design itself. Yeah. So yes, it's like the what is the difference, it's like I think, it's like it is encouraging this, it's like getting feedback from users and testing out in the community. Yes.
Great. Thank you so much, Professor Theng. Yichi, the next question is to you. So people are really excited about the project that you've done, and they're wondering about your plans to scale up the project, whether or not it can be sustained, particularly given that it relies on a large number of volunteers. So I wonder if you have thoughts about that.
Thank you for the question, and thank you for the interest in our project. Yeah, really appreciate it. Yes, we have a plan to scale up the project, and we want to bridge, especially those seniors who are not really using the healthcare system. So what we want to do, I'm not sure if just now you have noticed the disclaimer for our community telehealth service. We are not there to replace, but we are trying to to link those who are not using the health services back to the healthcare system. Yeah. So yes, so we hope we can have more faces at different locations, so that more people can benefit from it. Then how it can be sustained, I think that's always the question that we keep in mind when we started the design process. So I think the identifying the barriers and based on these barriers, then develop the implementation strategies are really important. So for example, what we tried to use is, actually, the development of the project was using the asset-based community development approach. So what we did is we tried to use whatever resources in the community rather than creating new resources. Then we try to integrate those existing resources and work with different partners to make sure our project can be scalable. Yeah, and at the same time, the continuous improvement, the ongoing improvement of the project is also important, so that when the users really use our service, they find that, oh, it's really useful and also easy to use, then it can potentially increase their intention to use. And in terms of the volunteers, actually we work with we are very lucky we have the support from different organizations. First, we have NTU. So NTU helped us publicize our project, and we managed to have many student volunteers not only graduate students, but also undergraduate students, medical students. And the medical students also help us review our medical perspective of the project. And also we work with different health clusters. We work with NUHS and SingHealth. And at the same time, some community organizations and also Giving.sg was also helping us to discover new volunteers. And those strategies are quite useful. Yeah, and yeah, we really managed to find really, really good and very engaged volunteers, and some are some had healthcare background before they retire, and we really attracted volunteers from different age groups. Yeah.
Great, thank you so much, Yichi. So we don't have very much time left, and given the volume of questions, I'm actually going to just summarize a significant portion of them, which have to do with the challenge associated with co-designing with older adults. So this goes to both our speakers. There are some questions there about language barriers, for instance. What about older adults who don't speak English? There are also, older adults who might be slightly resistant to technology, for instance. And so for the last sort of like maybe 2 or 3 minutes each, could you maybe talk a little bit about how you have overcome specific barriers that older adults might face, particularly when you're trying to incorporate their ideas and their experiences in your programs?
Yeah. So maybe I'll start first. It's like for older adults, yes, it's like in Singapore, I think majority of them, it's like as we go to the active aging centers or community centers, most of them speak dialects or Mandarin. It's like, so we have to do that, it's like in some of the sessions, right, where we have our researchers, it's like knowing how to speak, it's like Mandarin or the dialects, and even conducting interviews and focus groups. We do that. For the Malays and the Indians participants, usually they understand English. So it is okay. So basically it's just English and it's like Mandarin. We can cover quite a lot of participants. Yeah. In terms of technology barriers, as I mentioned, it's like when I started in 2010, it's like people were very afraid. It's like, but what we did was, it's like you have to gently, it's like coach them to use the technologies. It's like, and that's where, it's like user-centered design is important. You have to make the design so simple. So inside, our technology, although it is still a prototyping phase, right? Basically, it's still very untidy in terms of the design. But one of the things that I've stressed in our system is a one button, it's like access. That means, it's like start, it's like stop, go, or, it's like you don't need them to do a lot. It's like so that the interface is simple to use, and like what Yichi has actually also highlighted, and it's very important when it comes to it's like design of systems. It's not about just the ease of use. In fact, in HCI, we have found that usefulness, that means what it intends to do, right, is even more important than usefulness. It's like, so the usefulness, it's like if there's helping them to achieve certain goals, I think that will make them, it's like continue. Even though the design may be a little bit tricky, it's like they can still continue. So yes, it's like simple design. Tech barriers, it's like I've seen one question which says that, it's like if they don't have mobile phones, we actually gave them, of course, this is a user study, it's like, so we actually purchased, it's like these devices for them. For the community engagement, we also have funding, it's like to implement some of these like systems in the community. But when the community sees that, it's like this is actually very useful, because we can only buy X number of finite sets. We do have community centers purchasing now, it's like the set that they put in the community. So as I have also, the icing program, we design our own Excel games, but, but we also have downloaded, or purchased other Excel games that we can use from the market. Yes, we need to have more, ways to get, technologies to the elderly, so that they can actually use it. But today it's not as bad as, 10, 15 years ago.
Great. Thank you so much for visiting. Yichi, what about your reflections on some of the challenges that you might have faced?
I feel they face multiple fears. So the first fear is fear for a new concept. So some of them, they just say, oh, whatever I have now is already enough. So I don't want to know a new thing, for example. Yeah. So I think we need some strategies to overcome this kind of fear. The second fear is fear for participation. Some of them, they say, especially for focus group, I feel that for individual interviews, it would be much easier. But for focus group, I need to think, I don't want to speak in front of a group of strangers. So what we do is we can encourage group participation, because I find currently, what I find is our older participants, they all have their social network and they try to encourage each other to participate together. So I feel this is quite helpful. So they are in a relatively more familiar environment, so it's much easier for them to share. Yeah. The third fear is fear for a stranger. So they can talk to their networks, their friends, their family members, but as a researcher, sometimes they feel, you are a stranger. So I think building the trust, building the rapport is very important before the session. Yes. And the next fear is fear for saying something wrong during the co-design. So we have to set the ground rule. So there's nothing right or wrong. Just feel free to share whatever you think. Anything you share will help us improve our design.
Great, thank you so much. And I'm going to leave the last question to me as the moderator. I hope you indulge me to take the last question from me. And actually, it's a question that is also reflected in some of the queries from the Q&A, which is given sort of like the co-design process and the multiple stakeholders who are involved, what is your approach to ensuring that the solutions sustain even after the project is over? So looking at the interventions, for instance, how do we make sure that even after the project ends, or if major stakeholders exit the project, how do we ensure that within the community, some of these interventions continue to live on? And this will be the last question, after which we'll have some closing remarks. Professor Theng?
Yes, this is a very good question. I think I'm learning how to do this. And I think it's important for us, to do careful planning. Whether you have knowledge transfer and as well as long-term, integration strategies, that's important. So I'll give an example of, as I mentioned, I'm actually learning how to do this, right? One is actually to build capacity, foster ownership, and if it is possible to integrate into existing systems. One of the challenges that I face, in research projects, a lot of times we do use inspired, kind of like projects, right? You think this is what you want to ask a question, but really in reality, nobody wants to use it, then that is a problem, after you've done 3 years of PhD and that's it, nobody wants to actually do, integrate it into the system. And I think for projects that we want it to be, a lot more, sustainable, is really planning for it to be adaptable, and co-designed it with the key stakeholders. One of the challenges that I face for research projects, that's why, for ARISE, we want to look at translation and implementation science, because that's important for the long, term, purpose of this, projects, right, into the community. So for example, like icing, we have actually 3 years of funding, 2023, 24, 25, right? This 3 years, we really hope that we can come up with some, good protocols, methodologies, and we train people on the ground so that, if we have no more funding, the projects can continue. And we are very pleased that, Agency for Integrated Care has provided support, for this year. If it goes on well, then this will be, continued, by the government agency. So my advice is that for many of our research projects, try to engage the agencies as early as possible. That. Of course, there are different ways in which we do a project. A research project, funded, try to get the agencies, engaged as early as possible. For a PhD project, it's slightly different. You're more driven by, theories and so on. But for use in the community, it is good to engage, for example, like MOH, AIC, all the active aging centers, all the communities, so that, we work alongside with them for the problems that they face, and we can also provide solutions that can be integrated in their existing systems and programs. Yeah.
Great. Thank you so much for visiting. Dr. Zhang, you have the last word.
I fully agree with Prof Theng. Yeah, involving different stakeholders as early as possible is really important. And at the same time, we feel that our strategies that we use should be logical and evidence-based. This is also very important. So we have different frameworks or models in implementation science to guide us how to develop the sustainability plan. And also, I feel that it's also important to to keep the potential users engaged. So normally in our design, what I do is I try to involve the non-users. So by understanding why they are not using or they do not have access to whatever service or program that we want to design, we have a better idea of the barriers so that we can also engage them in future development. Yeah, and also I feel that the documentation of the whole process is very important. For example, for the community telehealth service project, because that project has been implemented in, I think, 2 to 3 years, and when the senior PhD student graduated, then the juniors will take over. So the documentation is really very important for them to really, and also a proper handover is really important for us to get the new leadership on board, smoothly.
Great, thank you so much. And with that, we come to the end of today's session. I'd like to thank both of our speakers for taking time to share your invaluable insights. I'd like to thank the audience for all of your questions. I apologize that we're not able to answer all of them, but what we're going to do is that we're going to collate them, hopefully get inputs from our speakers, and then we'll publish this on the website. Unfortunately, we don't have all of your email addresses because some of them are anonymous and to send them to you individually, but we will collate them and put them together. Just as a quick summary, I'd just like to again bring everybody back to the main takeaways from today's session, which is, as BISI, we are really interested in the implementation aspects of research projects. And both of our panelists today talked about how we can make elements of their projects attractive so that people stay on them despite the long journey, make them accessible so that people understand why it's helpful for them. And then from the Q&A responses, we also hear about how we need to work with community stakeholders to make sure that even after the research project is over, that the findings and the benefits continue to have benefits for everybody involved. And that really is the core of why we want to do co-design, right? It's because we want to involve the people whose well-beings are at stake. So once again, thank you, everybody. I also like to just take this opportunity to plug an upcoming BISI course, which is a design and evaluation program to improve mental health. So you can see that the information is on your screen. There is a QR code for you to scan for your registration. We're going to be hearing from Professor Claire Henderson from the Public Mental Health College at King's College. And so all the information is there. Please look forward to it and sign up if you're interested. Once again, thank you, everybody. And thank you to our speakers. Have a good day ahead.